Now, things to avoid. Certain medicines are very important to avoid, things like aspirin after, before surgery, because it makes you bleed more. It's important to avoid certain herbal teas. A lot of times we don't know what type of teas or components are in those teas, but there are things like ginger and other things that will make you prone to bleeding, and it will, cause a complication in your post-operative period. So it's very important that you talk about your surgeon about the things that you're having. For example, fat burners. Fat burners is a very, common topic, and we always recommend against the fat burners because they have certain aspects that might make you have problems with your heart or, even the anesthesia. So it's important that you tell your surgeon everything you're taking, every medication, and even what you are eating in the pre-operative period, so we can advise you on what to stop taking. Omega-3 acids, it's very important. This is something that is within the normal supplement. And yes, of course it's important. Fish oil and omega-3 acids or fatty acids and oils, it's important that you stop those because those also make you more prone to bleeding. These are things that you should avoid. And let me give you a little bit of a perspective on diet overall. How can you lose weight? Keeping a good portion and proportion. This is part of the education that is not out there, but it's very important. You have to manage your portions, and within that portion, the proportion. And there is a certain portions of carbohydrates, a certain portion of fat and proteins that you have to have. And usually it's 40% of carbohydrates and 30% of proteins and 30% of fat. If you keep that proportion in your meals, you're gonna have a balanced diet. This is not things that you find usually in fast foods or easy foods that you can get anywhere, but it's important that you at least know about this, make a little more research, instruct yourself just to see on how to understand what is a healthy diet and how to lose weight.